It's been just over 1 week since President Biden took office, and he's already signed dozens of executive orders on everything from climate change to health care to racial equity, in many cases battling the legacy of his predecessor. The nation, meanwhile, continues its battle against COVID-19. Nationally, infections have trended downward lately, but new, more transmissible strains have now been found in the U.S. Over 3,800 people died on Thursday alone, bringing the total death toll in the United States to over 430,000 people. And concerns over the speed of vaccinations continue.
The brutal truth is, it's going to take months before we can get the majority of Americans vaccinated. Months.
A public health crisis, an economic crisis, and an opposition party at war with itself. The Biden administration is facing conflict on several fronts. How will they respond? Joining us tonight, 4 reporters covering it all. Garrett Haake is correspondent for NBC News. Weijia Jiang is senior White House correspondent for CBS News. Sarah Kliff is an investigative reporter for the New York Times covering the American healthcare system. And Anita Kumar is White House correspondent and associate editor for Politico. Welcome to you all, and let's begin with the pandemic. Sarah, I want to ask you about the news out of Washington that affects the entire country, and that is the vaccine rollout. Every state has had some kind of issue. Most states have issues with supply and distribution. What do we know about the Biden plan moving forward? When will people out there watching be able to get their vaccines?
You know, it's an excellent question that I and millions of Americans are wondering about. And you do see the Biden administration, setting up a plan that is a little more thorough than the Trump administration. They are taking advantage of options to purchase extra vaccines from drug makers. They are talking about the possibility of setting up these mass vaccination sites. But the fact remains that it's going to take a while. As we just heard President Biden saying at the top of the show, this is going to be a months-long effort. The Biden administration does believe they've been able to purchase enough doses to vaccinate 300 million Americans by this summer. But again, that's a months-long timeline when we've all been in quarantine, obviously, for quite a while. So they are, ramping up. They're trying to get this right. But we are seeing it's still a hard thing to vaccinate the entire country at once. And it's going to be an effort that stretches into much of this year.
It's an unprecedented effort for sure. And Weijia, we know that President Biden has much of his team now in place, even though his nominee to run HHS, Xavier Becerra, has yet to be confirmed. That's, of course, a key post when it comes to the COVID response. But based on your reporting, what is that team working on? What deals are they working towards? Where's their focus when it comes to curbing the pandemic?
Well, as we were just talking about, it really is trying to get as many shots in the arm as possible, and that means having the supplies to do it. Everything from the syringes that are required to the vials to the vaccine itself. And we saw this week the president talking about ordering more of the Pfizer and Moderna vaccines. And so they're really focused on making sure that there aren't any points along the supply chain that are going to be held up. Of course, that is really difficult because even though the president has invoked the Defense Production Act, it's different from actually compelling companies with contracts, and they are in the process of working out those details and making sure they will have what they need to get the shots in the arms. And then when it comes to the vaccine itself, it's a little tricky because there is a global demand for the same thing. And so they really have to think about what other countries have contracts too. But, the big picture is very clear. The president is making the pandemic his #1 priority because when he talks about every other crisis that this country is faced with, he views it as it being tangled up in COVID-19. And so that's where he's beginning from the top.
Anita, what about making sure those vaccines they want to ramp up are getting to the people who need them most? We've all seen the disparities. We've reported on them time and time again. We know that Black and Latino and Native communities have been hardest hit. The limited data we have so far shows that that's not where the vast majority of vaccinations have gone so far. Does the Biden team have a plan to close those gaps?
Yeah, they've talked about it a lot. The vice president's talked it about a lot. This is one of her issues that she hopes to help with. But so much of what the president wants to do with the vaccine is tied up with Congress, with this massive bill. So you're talking about vaccines. They want to open vaccine centers at community centers and stadiums and all sorts of places around the country. Well, that all takes money. That's why you're seeing the president talking so much about this bill, this $2 trillion bill that he hopes Congress passes, that's really not getting anywhere so far. So much of what he wants to do is really tied up in the money and Congress giving him that authority and that money to do what he needs to do. We did see a lot of executive orders, but when you look at what those are, a lot of that is, things that he already could do, or things that, studying things or appointing people or having a commission. What he really needs now is for Congress to pass a bill.
Well, Garrett, let me ask you about Congress. Before we get into some of the politics of the potential relief deal ahead, one of the clearest sort of visual differences we've seen with the Biden administration that a lot of people have noticed, and between that and his predecessor, is just the masking. Every time you see someone from the Biden administration, they are masked at photo ops, at signings, at briefings. What about on Capitol Hill? There has been some division there before. When you're walking around there, while people around the country are being asked to take precautions, are lawmakers doing the same?
Well, the vast majority of them are, although I have to tell you on Congress, it's moving the opposite direction, in part because so many members have now gotten vaccinated. Now we're actually at the point where member staff are getting vaccinated. They are at the front of the priority line. And while it was controversial, particularly for younger members of Congress to be some of the first people in the country to get their shots, we're now seeing more and more of them getting even their second doses and starting to move a little bit away from universal masking, although it's still, the law of the land on Capitol Hill and likely will be for a long time as more and more people who've been largely working remotely start to come back to the complex.
And Sarah, we mentioned, of course, that new strain, the more transmissible strains that have now made their way to the United States. How has the emergence of that new strain complicated or changed the U.S. pandemic response?
I think it just heightens the importance of vaccination and getting those shots into arms as quick as possible. You're essentially setting up a race between these variants and the vaccines. I think that was really heightened by news we got today showing that some of the newer vaccines rolling out, Novavax, Johnson & Johnson, are less effective against some of these variants. So really it just amps up everything that is currently happening. It makes it so much more important to have widespread vaccination quickly because you want to kind of cut these vaccines off, at the knees. You don't want to let them get too far into the country. I really think it makes the next month or so a really critical period and just heightens the importance of everything the Biden administration is trying to do. Getting shots into people is just so much more important when you have these variants that are more contagious starting to circulate in the country.